Hi, my name is Jerry Folsom, and I'm the CEO of Allen Technologies. We're very happy today to have Maria Hale, Vice President of Patient Advocacy of Northern Westchester Hospital, with us today to talk about the use of our patient tablet there. Joining Maria is Maureen Lopez, who is the Director of Clinical Informatics, and they're going to talk to you today about how our tablet is deployed at Northern Westchester Hospital. So Maria, I'll turn it over to you.
Thank you, Jerry. So we're going to talk to you about something really interesting and cool, okay? And this is revolutionary. It's not out there at the patient's bedside in acute care hospitals. And we're excited to be able to bring it to you today to talk to you about our journey and how we use it to engage patients in their care. So what we've developed is a tablet device with Allen Technologies. And we chose to go with a tablet versus some other type of device like a swing arm because we wanted to have patients have the flexibility to be able to view the information in their bed, also to be able to view it if they were sitting in their chair, so they're not tethered in any way. We also went to our patients themselves and said, if we were to do such a thing, what would it look like? What would it feel like? What would be the types of information that you would want to see it? And so our patients said, if it looks like an ATM, I'll use it. So make it simple with like big buttons that I can intuitively know where I'm going. If it's too complicated, I'm not going to use it. And also, I'm not feeling so great, so I don't want anything complicated and to add to my level of anxiety. I just won't use it. So they gave us the footprint of what the hardware would look like. The software, when we talked to them about it, we said, so what were the types of things that you would like to see? And they gave us the roadmap to begin our journey of what we were going to develop with Allen. So the first thing is, when a patient logs onto the tablet, how do they get onto it in a private and secure fashion? The first thing they do is they wave their band, their wristband, and there's a barcode scanner on the back of the tablet that the patient puts their wristband in front of, and then it identifies that patient. There's also a unique identifier where they enter their date of birth. And then once they do those two things, then it connects to the right patient and it brings up the information. The first thing the patient said they wanted to see was they wanted to be able to see who their care team is, because the care team changes. Every day you might have a different nurse. There might be a different hospitalist that's assigned to you. So the patients not only wanted to know the name of the person caring for them, but a little bit something about them, specifically their credentials. So if we tap on the physician's name, you'll see the physician's picture, you'll see where they went to medical school, you'll see where they did their residency, any fellowship training, and you also get credentials for the nurses as well on the system. Very easy for the patient to see. The labs were another area that patients wanted access to. And specifically, they wanted access to the labs that they need to have to control their own health and their condition. Something like glucose. Glucose results, patients test their glucose at home. If you're a diabetic patient, you're used to doing that. And when you come into a hospital, you lose that control and you have to ask a nurse or somebody for that information. Here, they see the glucose results right away. They can graph it. They can see it in numerical form. They see it in a range, so they know how they're doing along the continuum. If they click on one of the graphs, it'll tell them what that specific range is and when it was taken. Another type of lab that they wanted to see was cholesterol and triglycerides. If we hit total cholesterol, you can see that in this view, it's a stoplight view. It's very simple. It's either green because you're at the ideal. If you're yellow, you're in that borderline range. And if you're in the red zone, oh boy, we got to do something about that. So it's very easy to see. Same with triglycerides. We kept with the same stoplight approach. They can also see blood type. Also important to patients is their medications, obviously. They want to know what medications they're on. And not only do they want to know what medications they're on, they want to know what it's for and if there are any drug interactions or food interactions. So if you click on one of the medications, click on Lovenox, What will happen is the information about that drug will come up, and the patient can read about that information, how to use it, what it's for, any potential side effects, and at their leisure. The way the nurses work with this information is when they come into the room, they'll explain to the patient that they're on this drug. The patient will repeat back to them what they understood about that drug. But many times the nurse will leave and the patient will be like, no, what did she say? And oh, my daughter's going to come in at 3 o'clock and I know I should tell her this, but I can't remember what she said. So this way the nurse says, I just talked to you about Lovenox. Now let's bring it up on your tablet so that you can reference this when I leave. And I know your daughter's going to come in later on and she might be very interested in getting this information. So we use the system not only to give access to the patients when they want it, but the clinicians use it to augment their teaching. The doctors also use the tablet not only for the lab result conversation, but we also give the doctors the ability to show x-rays on it and different types of images. So they can pull up the image right at the bedside and be able to talk to the patient about what they're doing, or maybe they need a surgical intervention. They'll be able to show the patient right there the image. Also are able to see what's going on in that day. So if there was a CAT scan ordered today or a Doppler, they can plan for their day. They know that's going to happen. And they know what's going to happen, and they'll be able to tell their family members. Maybe somebody's going to come visit them in the afternoon, but they're going for a test or procedure then. Patients wanted vital signs. They wanted to know what their temperature was, their blood pressure, their respirations. They want to be able to graphically display these as well as numerically, and you can do all of that through just the touch of a button. Even though our hospital's wonderful and we give them a lot of wonderful amenities, everybody wants to get home. So here we want to be able to prepare them for that. So we tell them, you're going to be here for a couple of days, and these are some things that you need to do, you need to start getting prepared for, and we're going to help you with so that we can help you transition back to your home. The main screen has a series at the bottom of special things patients can do at the bedside. Patients want to have control over doing things, simple things like asking for more towels to be brought to their room, or maybe they want their room tray to be removed, to more advanced things. Maybe they want to speak to the pastoral care minister. Maybe they want to have the dietitian come up to the room and have a consult with them. Or they'd like to speak to the health librarian to get more information. They also can compliment the staff. I mean, they can send a brief note to a staff member and thank them. The Allen system brings a lot of things right there to the patient to have control over.
The patient is oriented to the room and to the tablet immediately upon entrance to the facility. So when the nurse is in there telling them all about the room and the call bell and the safety features, they also bring the tablet and they give it to them in their hand almost, because the patients see this device and they automatically assume it's for the medical team, it's for the clinicians. And then they're happy to find out that it's for them to use for many, many purposes, including accessing their chart and their lab results and their discharge information. All of the nurses use the educational feature. There's a video library that the patients get assigned X amount of videos when they first come in. Some of them are just straight health and wellness. Some are disease processes. When the patient watches that video, the system writes back to our HIS system. So the nurse can say, patient has watched X video today. Let me go in and review it with them. Let me see if they have any questions. Let me see if they want more information. So it's a good starting point for a dialogue and a conversation. And then they can bring the caregivers and the family members into the process, because the patient watches it in the morning and the daughter comes in the afternoon, they can sit and have that conversation. So we find that through the hospitalization, they're looking at things, getting them ready to go home. And it's an excellent tool, and it is technology. The younger folks love it because they love anything technological, and the older patients are intrigued and they can actually use it, so they feel kind of satisfied. So it's been a good little partnership. We're happy.